Hello everyone, I am Dr. Vikas Singhal, Senior Consultant GI and Bariatric Surgeon at Medanta Medicity Hospital in Gurgaon. Today I want to discuss about which bariatric or metabolic procedure is more suitable for patients who are planning the surgery for diabetes care. So we know that most patients who suffer from type 2 diabetes, it is associated with obesity. Almost 70-75% of patients who are diabetic tend to be overweight or are suffering from obesity. So if somebody is planning a surgery particularly for control of the diabetes, then there are several factors that we look at when a patient comes to us. One of the most important factors is what is the duration of diabetes, whether they have been diagnosed with diabetes only recently or if they have been long standing diabetes, as in more than 5 years. The second factor that we look at is that what is their current treatment, whether they are only on tablets or whether they are already on insulin. Uh, the third factor that we look at is that what are their blood reports like, what is their sugar control like, whether the sugars are well controlled on treatment or they are still not controlled on the treatment. We look at the HbA1c parameter, whether the HbA1c is controlled with treatment or it is very high. So put together, all of these factors will help us determine which surgery to recommend to a patient if they are planning the surgery for diabetes control. We know that bariatric or metabolic surgery works very well for diabetes control, and 70 to 80% of patients can be completely cured of diabetes. एज इन कहीं मोस्टली उनमें दवाइयाँ बंद हो जाती हैं, इंसुलिन भी बंद हो जाता है, एंड द इफेक्ट इज सो फास्ट दैट सर्जरी से अगले दिन ही वेरी नेक्स्ट डे वी फाइंड that we are able to stop the insulin and sometimes put patients on tablets. If they were on tablets, we are often usually completely able to stop the tablets. So based upon all these factors, we discuss with them whether a sleeve gastrectomy or the gastric bypass procedure will be better for their diabetes control. The patients who are long-standing diabetics and who are not very well controlled, we prefer the gastric bypass procedure because studies have shown that in the long term, the remission of diabetes tends to be better with the gastric bypass procedure, whether it's the Roux-en-Y gastric bypass or the mini gastric bypass procedure. So ultimately, it is an informed decision that we discuss in detail with the patient, that which surgery, how the surgery works, and which surgery will be very effective for them for diabetes remission in the long term. Thank you.